having one single partner probably is out of fashion now. People are career conscious, they're very ambitious, they want to build up houses, they want to build up not one, but maybe 5 houses. If you're a model, if you're an actor, if you are whatever, you know how long you're going to take that. Gone are the days when people would look at sex as one of the pastime. Now it's absolutely on doctor's orders. We have a moral degradation of the society where kids have sex at their beck and call. It can cause a ravage with your fertility system because please go and freeze your eggs. If Apple and Google and Facebook paid their employees years back to go and freeze them, it's worrisome because not only female but even male semen parameters are going low. Please freeze your career. It'll better, I would tell you. And I'm a very, very ambitious woman myself. And if it's coming from my mouth, I really mean, because the fertility clock doesn't wait.
So what's the best age? What's the best fertile age for a woman?
If you ask
Earlier
me,
it was 21.
Yes, it's
29.
21 to 24. If you ask me, is the best woman's egg.
There's a misconception that infertility is a rich man's disease,
Right.
that people who smoke or drink or, party or don't have a lot of stress. So, infertility is meant for them. But I mean,
Hello, Adab, Namaste. Welcome to another episode of India's Business Legends. Today we've got with us Dr. Rita Bakshi. Now you'll be wondering, why are we meeting a doctor at India's Business Legends? So you'll soon find out. Hello, doctor.
Good morning.
Good morning. So our viewers would also want to know, why are we having a doctor on our show?
I think you can't do without doctors, first of all. Secondly, I am an IVF doctor. And IVF is rising, that's what people say. Why every single couple is getting an IVF done? Well, you have to understand that there has been a schematic change in the climate today.
True.
There have been, girls and couples are getting very ambitious, really career conscious. They want to postpone their fertility. And I think the ravage caused by media, whether it is internet, whether it is Netflix, whether it is YouTube, whether it is reels, stories, whatever you say, it is occupying people's real time. Gone are the days when people would look at sex as one of the pastime. Now it's absolutely on doctor's orders. And that is the reason why I think you should have a doctor on your show and to explain all this to the viewers, why you should be restricting all these kind of activities and really focusing on your fertility life.
So that's an insightful one, and I'm sure this is going to be something very exciting for all of you also to understand, why IVF is increasingly becoming so important for all of us. So what exactly is IVF? Let the layman person, let the common person understand.
एक होता है बॉडी के अंदर बच्चा बनना, ओके? अपने बॉडी में एग है, राइट टाइम पे स्पर्म आया, स्पर्म और एग मिले, and the baby is formed in the fallopian tube and then travels into the uterus and you get pregnant. Now it is not happening, tube blocked है. आपका, you see, रास्ता क्या है? यहाँ से एग आया, but it has to travel through the tube. And if your tube is blocked, it can't travel. अगर sperms बहुत कम है, वो नीचे ही खत्म हो गए, ऊपर तक पहुँचे ही नहीं. Endometriosis है, tuberculosis है, so many diseases which are affecting this area. अगर ये सब है और वो अंदर बच्चा नहीं हो रहा, now we don't know why नहीं हो रहा, what can we do? I bless this science and I bless Edward and Steptoe who devised this process of in vitro. What is in vitro fertilization? In vitro मतलब outside the body. तो अगर हम फर्टिलाइजेशन आउटसाइड द बॉडी कर रहे हैं, एक टेस्ट ट्यूब में, जिसको टेस्ट ट्यूब बेबी भी बोलते हैं, क्योंकि हम जब करते क्या है, आईवीएफ में होता क्या है, हम 10 दिन एक कोई भी लड़की अगर कोई आती है या कपल आता है, सपोज वो 35 एंड अबव हैं, बच्चा उनकी शादी को 5 साल हो गए या 2 साल हुए या 35 के अबव, तो मैं कहूँगी अगर 6 महीने भी हो गए हैं और आपने ट्राई करा है और आपको बच्चा नहीं हो रहा, वॉक इन टू द राइट फर्टिलिटी क्लिनिक एंड आपको अब करेंगे क्या, हम आपकी जांच करेंगे, टेस्ट करेंगे एंड देन वील कॉल यू ऑन योर सेकेंड डे ऑफ योर साइकिल. सेकेंड डे से 10 दिन के उनको इंजेक्शन लगते हैं, पेट पर लगते हैं, वेरी सिंपल, खुद लगाते हैं पेशेंट्स। आप ये मत सोचिए एक नहीं, हर पेशेंट खुद लगाता है, तो इसका मतलब कितना आसान है। तो इंजेक्शन लगाए, हार्मोन्स होते हैं जो लगाए जाते हैं, और वो बीच बीच में हम उनको चेक करते रहते हैं कि उनके एग्स कैसे आ रहे हैं, यानी कि अल्ट्रासाउंड होता है। और 10 दिन के बाद हम उनको थिएटर, ऑपरेशन थिएटर ले जाते हैं, जहाँ थोड़ी सी बेहोशी 5-7 मिनट का प्रोसीजर है, दी जाती है, बिल्कुल पेनलेस, और विजाइना के थ्रू एक नीडल डाल के सारे एग्स जितने उस समय बने हुए हैं उनको बाहर निकालते हैं इन अ पेट्री डिश। So once the eggs are there in the petri dish, we ask the husband to ejaculate and give a sample, and वो sample हम then we pick up this egg and we take out the best sperm and do an ICSI or intracytoplasmic sperm injection. अब ये बच्चा एक तरह से हमने fertilize करके बना दिया. Now we keep it in the incubator, which is just like a body. जैसे बॉडी के अंदर होगा ऐसा we replicate it outside. We put it in the incubator for 3, 4, 5 days, and then we take out. I can see the cell multiplying. I can see the baby forming, and I just have to carry it in the catheter, and of course, put it right into the woman's uterus. So tubes का मतलब नहीं है, nothing. It doesn't matter. Baby is formed. Baby is ready. Now I have to put it inside the uterus. Now, of course, whether the uterus will accept, not accept is another thing. But we have bypassed many procedures. हम ये तो कह सकते हैं हमने बच्चा बनाया, देखा, then we put it inside. So this is in nutshell IVF for you. So I would say the procedure is about 20 days from the day of cycle. जो हमारे पास बाहर से लोग आते हैं, we tell them कि around 3 weeks लेकर आप आना, ताकि आपके पास उतना खुला टाइम हो when we can do the whole procedure. जैसे ही हमने डाला, of course you can go back. You can test after 14 days. So it takes about 2 weeks after we put it to check whether she's got pregnant or not. Okay. And another 2 weeks to know whether the heart is there or not. So this is how the procedure of IVF works.
After that also there is a little possibility that the heartbeat may not be
Of
there.
course, just like any other pregnancy, कितनी बार आप सुनते हो कि test positive आया but बच्चा नहीं,
it happens.
So many times you'll have a miscarriage. So it's the same thing in IVF.
Okay.
But only thing is कि बहुत सारे steps which are not happening in the body, we are able to replicate outside.
So doctor, let's go back a little in time. Let's go back to the time when you started your studies. And probably around 1990s was the time when you finished your medical studies. And that was the time when girls weren't very aspirational, and studying medicine was probably a taboo. How did you deal with all of that?
I think I bless my father, who is not here anymore, who was really keen that we were 3 daughters, and he wanted each one of us to become a doctor. Of course, I only fulfilled that dream of his, and I'm glad he desired and I fulfilled. Because maybe as a child you don't know what you are getting into, but definitely I think philanthropy, helping others was in and empathy in my nature, probably really channelized my energies into a profession like this. And I'm very glad I took up medicine as a profession. Well, way back in, you're right, in 90s, it was not very common for girls to be taking up a profession like this. But I did my post-graduation from Safdarjung Hospital, Delhi, which is one of the largest hospitals all over Asia. And after doing that, I joined public, because I wanted to be with the public. I wanted to hone my skills to the maximum. And I worked for 16 long years with common patients, understanding their problems. I, in fact, even really speaking, made myself expert in cancer surgery. I did cancer surgery from AIIMS. And then, after having delved into all the fields, I thought the pain of infertile couples was something that was really pinching my heart. And I thought this is one thing which can transform their lives. Then I thought, why not hone my skills only into a field? Let me super specialize into IVF. I trained from the Indian Legion, Dr. B.N. Chakravarti at Calcutta. Then I went to Singapore, Belgium, and from all the places in the world, I got all the skills that are required to get and become an expert into this field.
So you were possibly one amongst the first few people to do so.
Yes, I can say that yes, into some of the people had started, but yes, one of the first few, yes.
So when you started, of course, one way is to probably sit at a government hospital. This is the way doctors go. And there's another way also that you start your own clinic, which makes it more accessible to many more people. And you chose the second path.
Absolutely. So you know what? Government hospital at that time did not have IVF into their streams. So for IVF, people had to come out in the open. Now, of course, you know, even to talk of Delhi, All India Institute of Medical Sciences, Maulana Azad Medical College, Safdarjung Hospital have just started. So, you know, it has not been very long back. So at that time, if somebody wanted to do IVF, and if you actually want to know, IVF is still not recognized in insurance schemes. So it is still, people have to spend from their pocket. So that still means private. So at that time, I thought, you know, after having trained into it, I thought starting my own center. And we started with Adiva Group of Hospitals, of which I was a founder. And having run that for a few years, finally I chose to open completely my own international fertility center, better known as Risaa IVF today, you know, in which I have completely in, you know, it's run by me and of course my son Saarthak, who is looking into the business aspects of it. But this is how we came up with our own branch.
So when you started Risaa IVF in 2010, what was the scenario here in India like? I'm sure, you know, over the past 2 decades, things have changed a lot. But then probably the need for IVF wasn't as much at that point of time.
So in 2010, that's nearly 14 years back, IVF had started rising. And as I said, the rise you can attribute to many, many things. But that also said, you know, at one point we have a moral degradation of the society where, you know, kids have sex at their beck and call. And yet as couples, when they get married, maybe because of over excess and also because their time is consumed by many more attractions. And that actually, you know, because that's one major history we take. You know, what's the kind of frequency you have. So if they, you know, you have a frequency, say thrice in a week, we understand it's normal. But if somebody says once in a month, then your you know, your antennas start rising. Okay, there is something not absolutely correct here. So this is the first thing that I have to correct. You know, I mean, leave alone IVF or IUI or any other procedure. But first, let me correct the number of interactions that they have.
Right.
And that's why probably one is over excess, and over excess also breeds infections. The more sexually transmitted diseases a girl and a boy have because of multiple partners. It causes pelvic inflammatory disease, it can block your tubes, it can cause a ravage with your fertility system, because I think having one single partner probably is out of fashion now. So this is what probably is one reason why we have an increase in fertility clinics, increase in people who are going on for these kind of services. That's one. Secondly, I would also like to point out, and which I am not able to fathom myself, is the decreasing fertility potential of people. You won't believe when I'm looking at girls at 30, 32, 33, and their egg reserve is extremely low. So this is worrisome. It's worrisome because not only female, but even male semen parameters are going low. And the reason is probably some kind of pollution that we are facing, whether it is in pesticides which have been introduced into the seeds.
Right.
Yeah. If you see a plant growing today, if you remember when our mothers used to make sabzi and matar ko chhilte the, so you could see keeda.
Yes.
In gobi, you could see keeda. Where are the keedas now? Why have they disappeared? It's because they have genetically modified the seed with poison or pesticide. Now, if you are eating poison, if your next generation is brought up on these pesticide control, it's going to cause ravage in your system. And that's probably where your reproductive system is also taking its toll. Now, look at your cancers. Every second house, you'll ask one or the other cancers there. So, we all have to be very consciously looking into this. Not that we can help it. I mean, what will you do?
What can I do?
What can you do?
If
Even if you were organically growing, but you can grow maybe a little bit.
True.
You can't grow
It won't
every
last the
single
entire day.
vegetable and seed in your house and eat that. So somewhere, I think we all have to be conscious of our environment and the government. I would really going like through your channel to make the government, let them look into all this. I mean, what is causing this kind of damage that's occurring everywhere? So these are the reasons for increasing IVF and increasing number of fertility clinics. People are career conscious, they're very ambitious, they want to build up houses, they want to build up not one, but maybe 5 houses before, they say, the other day I had this couple and he walked up and he came for surrogacy and the wife and husband were living apart and he asked me, he said, can you give me a child through surrogacy? I said, yes. I'm talking about 10, 12 years back. And we gave him one child. So it happened to be a boy. He came up after a year again. Said, can you give me another child? At that time, we didn't have the ART law in place. So I said, yes, we gave him another. And it happened to be a child again. This time he came back third. I said, you are not needy, you're greedy. What is the problem? He said, but I have 3 houses. So I want 3 children. So you've given me 2, can you give me third? So I'm just to say that the kind of greed couples have nowadays, they want to build up houses, they want to wait for their babies, they don't want to build up babies. So I think this is very, very important. And on this point, I would like to tell you that egg freezing is come of age now. That's like IVF, now it's egg freezing. Please go and freeze your eggs. If Apple and Google and Facebook paid their employees years back to go and freeze because they knew these girls are one of the brightest ones. They are going to have babies, they're going to work and work. Then they said, at least go and freeze your fertility.
Right.
Because once your fertility is frozen, just like Dinah Hayden, she froze her eggs at 34 and at 42 when she got married, her eggs were still 34.
Yeah.
So, she could have a baby. If at 42 you get married and you expect that you will become a mother in a jiffy, no. So this is very important that, go and freeze your fertility if you are not ready to have a baby at the right age. Please freeze your career. It'll better, I would tell you. And I'm a very, very ambitious woman myself. And if it's coming from my mouth, I really mean, because the fertility clock doesn't wait. Every other clock I know you get a little behind once you have babies, you look after, you will have to give the few years. And if you have a very nice partner, maybe he will pitch in and he will give 1 or 2 years and so whatever. But whatever way you have, please don't postpone your fertility.
So what's the age at which a woman should ideally freeze her eggs and what's the upper age limit?
So there are 2 ages that we'll talk of, freeze eggs as well as IVF. Now with the ART law in place, this year, we got the law, so which says that for women less than 50 is the last, okay, and 55 for the man. So now if a 51-year-old woman walks in, or 52-year-old, or a 57-year-old man walks in, we can't do IVF, okay, because it has to stop at 50. After all, you should have time to bring them up. So it's 50 for a woman and 55 for the man. So please keep noting your ages also, because your time should, many times, it's not one, so many times, 57-year-old married to 30-year-old girl and he will walk in ki bacha de do. वो तो wife तो 30 है, but husband तो 55 का हो गया.
True.
We can't do it. So it's important to keep ages in place.
So what's the age at which a woman should ideally freeze her eggs?
So as I said, the eggs are best, of course, between 21 to 24. But I feel personally The moment you are around 31, 32, 33 is probably the time, and if you've not found the right partner, is the time when we should freeze our fertility. Because even if you find a right partner, it's not as if you're going to get pregnant the next day.
Right.
You want to have sufficient time to explore, to know that it's a right marriage. So I have a lot of couples who are into a marriage who are not doing well. सो अभी अलग भी नहीं हुए हैं, अभी डिवोर्स भी नहीं हुआ है, बट साथ में है एक्सप्लोरिंग. अब अगर मैं 5 साल इसको दे दूँ तो मेरी फर्टिलिटी तो गई. सो आई हैव टू फ्रीज माई फर्टिलिटी, लुक एट इट्स ओके, बात बन गई तो कोई बात नहीं, नहीं बनी तो आई हैव फ्रोजन माई फर्टिलिटी. सो दिस इज़ वेरी इंपॉर्टेंट. आई वुड लाइक टू इम्प्लोर. सो आई फील कि 29 से लेकर आप 30, 31, 32, 35. I get patients of 44 also, but those are not the right ages to freeze, Best will be before 40.
Okay.
And so anything between 27 to 40, I would say, is the age group I look at. Of course, government allows us to do till 50, but then we know that those eggs are not really the good eggs at all.
Also, India is obsessed with boys. Do you also get that? Do you also see that trend?
So, not India, I think the world is obsessed. Even other countries, sometimes I get, and to be very, very clear, this is the first point we tell them. अगर आप ये सोच के आए हो, अच्छा कई लोगों को मिथ है ये भी मालूम कि IVF में लड़के हो जाते हैं, पता नहीं, ये भी पता नहीं from where they get this, किसी का देख लिया तो ये लोग सोचते हैं. So we tell them very, very clearly, ये possible नहीं है. We have no idea. अब ये भगवान की देन है, किसी को जो दे दिया. And that's why government has a census. हम लोगों का हर महीने सेंसस जाता है, कितने लड़के कितने लड़कियां हुए. तो ऐसा नहीं है कि, तो इसलिए आई थिंक इट्स इम्पॉर्टेंट टू हैव अ बेबी. इन टुडेज एरा इट रियली डजंट मैटर male or female, but yes, of course, people do come with their choices. The other day, I had a very conservative Marwadi woman walking, and her daughter was studying abroad, and she was 23. She said, "Can you freeze her eggs?" I said, "Why? I mean, she's only 23 right now." She said, "But imagine, I want her to work for the next 12 years. She'll be 35. Why shouldn't she have 23-year-old egg rather than have a 35-year-old egg?" I mean, that made sense. She was clear. If you're a model, if you're an actor, if you are whatever, you know how long you're going to take that. Nowadays, these actors are having babies and having their careers. There were times when Juhi Chawla and the other didn't even reveal that they had babies because
they got married and their career got finished.
And exactly.
And what's the average price of getting this procedure done?
So IVF, let me start with what is the price at the government, All India Institute of Medical Sciences, is 65,000. Okay.
To get in,
no, I'm just telling a government price where the drugs are subsidized, their place, everything is subsidized, is around 65,000. Okay. Now, if you compare the prices outside, then it's around anywhere from 1 lakh to 1.5 to 2. So anything between 1 to 2.5 lakhs, depending on the kind of drugs that you use. So it'll, obviously, the more expensive drugs that are chosen are, your prices go up. But anything starting from 1 lakh. So do you think it's expensive?
At the cost of career, I don't think so. It's very expensive.
Absolutely. So I think it's very important. People have this myth that it's expensive procedure. No. The second myth I would also like to demystify is that it's painless. So people think, बहुत दर्द होता है, बहुत दर्द होता है. Only dard which is there is the dard of injection, which is like insulin. People take the diabetics खाने से पहले, वो सोचिए हर लंच हर डिनर हर ब्रेकफास्ट से पहले जो इंजेक्शन लगाते हैं, अगर वो दर्द आपका 10 दिन का दर्द को आप दर्द कहते हैं तो then it is. Otherwise, the procedure of ovum pickup is under anesthesia, so there is no pain whatsoever. Absolutely. And third myth that I also want to correct is छुट्टी लेनी पड़ती है, बेड पे लेटना पड़ता है. There is nothing like that. Now people come from their office, get the pickup done, go back to their office, and ऐसे ही embryo transfer करा के, there is no role of rest. it has been very clearly said. In fact, somewhere they are doing studies in which they are saying that rest is probably bad for. So अब वो नहीं है कि you are pooping on bed and there have to be 10 relatives around. No, you can just go up, get work. So where is the process difficult? Where is the process that's preventing people from coming and taking help?
Is that because technology has also improved in the past decade?
Definitely technology has improved. And when you start thinking, कैसा डर डर के करता है हर चीज़, कोई जो नई चीज़ कहता है, अरे नहीं नहीं इसको हिलाओ मत, क्या पता हिलने से कुछ हो जाए, क्या पता ये. So this is how you start. But when you have research and studies and जब आप देखते उठ गई, for me people come from US, they fly in और उसी रात को they fly back. तो वो पूरा flight and US, it did not make a wee bit of. Then you realize कि ये सारा is a big myth कि लिटा के रखो, कुछ मत हिलने दो, so that वो बच जाएगा. जिसको नहीं बचना वो कुछ भी करो नहीं बचेगा, और जिसको आना है रिजल्ट. So all these are not going to be detrimental to the process of IVF. If I can give a baby, and this is what I look at when I'm sitting and any couple across the table, I can actually empathize. I can see the pain, and I think every couple should walk out from my clinic with a baby. That's what I think.
There's another problem which is seen very commonly amongst girls nowadays, which is PCOS and PCOD, which impacts fertility immensely. What could be the causes for it, and what could be the solutions for it?
So
maybe this will help a lot of girls.
Absolutely. So polycystic ovarian syndrome or polycystic ovarian disease, as it is called, that means you have a number of eggs. You have many eggs, not less. अब ज़्यादा हैं, पर एक भी अच्छा नहीं है. Means you have small tiny bits, but you want one good egg every month. वो नहीं है. And क्यों होता है? Because you are on junk food, you are on stagnating life, you don't absolute sedentary, exercise नहीं करते. So these are the girls who are obese, who have acne, who have hair on their face. I can look at from far and say, okay, PCO. You'll have mustache, you'll have girls who have a lot of hair, and these are girls who are fat. They have underarms which are dark, and then they have there's so many features which you can clearly say this is a PCO walking in. And these are the girls, you only have to ask them to shed weight, and this is actually asking ये पूरे ज़िंदगी करना पड़ेगा. It's not कि आज हमने करा और फिर ठीक हो गया. So पूरे ज़िंदगी उनको एक्सरसाइज करनी पड़ेगी. They have to be off carbs, अपना restricted diet पे चलेंगे, एक्सरसाइज करेंगे, good sleep. All these things will add up to a nice disciplined life, will control their PCO also.
Also, IVF is thought to be very mentally traumatizing. People feel that a failed IVF cycle can also lead to a lot of trauma. How do you as a doctor deal with it, and how do you tell your patients to deal with that?
So the truth is that worldwide success of IVF is around 50%. Okay? It can be 30% in some clinic, it could be 40, it could be 50, but not more. So the moment a couple comes, I tell them, 50%, I don't say success. Now I say 50% chance you will fail. Okay. Are you ready? Because if they are ready for failure, then I'm happy, because then everything is a boon. So the moment, it's all in your mind. It's all in the attitude. If you don't try and you die without a baby, you'll always, अरे मैंने तो ट्राई ही नहीं किया ना, क्या पता मैंने अगर राइट एज में करा होता तो हो गया होता. नाउ विद साइंस इफ यू आर नॉट मेकिंग यूज ऑफ इट, इट डजंट मेक सेंस. और अगर मैं कहती हूँ चलो करा और फेल हो गया, एटलीस्ट यू विल बी आंसरेबल टू योरसेल्फ एंड से मैंने तो कोशिश करी थी ना. नाउ आई एग्री दैट इट इज, यस, ऑन दिस फ्रंट आई विल नॉट से दैट इट इज taxing on the body, on the mind, not on the body, on the mind. Emotionally, yes, when you spend money and you don't succeed, it is a little daunting. But I think it's like a spring. I just am happy when my patients are back on that seat. Then I know they have the resilience. कि उनको समझ आ गया कि हमारे को ठीक है, लास्ट टाइम मे बी लाइनिंग बहुत अच्छी नहीं बनी थी, यूट्रस वॉज नॉट रिस्ट. यू सी दीज आर 3 players, एन एग, अ स्पर्म एंड अ यूट्रस. अगर तीनों एक्टर में कोई भी फिल्म में इधर उधर गड़बड़ कर देता है तो फिल्म इतनी अच्छी नहीं बनती. सो यू नो दे अंडरस्टैंड कि अच्छा लास्ट टाइम हो सकता है कभी हु प्लेड ट्रूएंट या कुछ हुआ या तो यू नो व्हेन वी आर लुकिंग वी नो ऑल्सो, हम बोल भी देते हैं कि थोड़ा एवरेज लग रहा है. आई होप इट्स ओके विद यू टू यू नो इफ़ यू थिंक अगर आपके पास एक ही एग है और टाइम आपका निकल रहा है तो यू माइट एज वेल टेक योर चांस नाउ. हाँ, अब आप बहुत यंग हो तो अब ठीक है, वी कैन कैंसिल साइकिल, जैसे कि आप फिर से आ जाना. बट जहाँ पे इक्का दुक्का एग है तो आप चांस ले लो ना. That's it. If you're 42, today also I'm going to do this girl, she's 42 and she has only about 2 eggs. I don't have time. She doesn't have time. So we have to go ahead. So, you know, once the patients understand, they're psychologically, and we have a psychologist on board. Okay. So she takes sessions. She's holding hand all the time. You know, every day she's talking to them so that they don't feel daunted with it.
So how many cycles should a couple try?
Or to be truthful, there are unknown number of cycles written. The other day I had an Australian, she came on the 46th cycle.
46? So much patience.
Because the government pays there. Okay, they don't have to spend from their pocket. But here, because you're spending from your pocket, after all, you can't drain your resources to a level. So I would say 3 to 5 to 6 cycles people do. Yeah? So it's okay to be, you know, everybody to their own. When do they want to? मैं सबको बोलती हूँ लक्ष्मण रेखा बना लो अपनी. हम तो ऐसा नहीं कर सकते ना, क्योंकि हर बार आप आओगे, हर बार यू विल डू. तो ये लक्ष्मण रेखा भी तुम्ही को बनानी पड़ेगी कि मेरे पास इतना पैसा है, इतना वक्त में इतना तो दे सकता हूँ, इससे ज़्यादा मैं भी नहीं सह पाऊँगा. It's okay. So there somebody will come with 2 cycles, somebody with 4, somebody with 6, whatever.
All right.
But there is no number written. But I would say around 4 to 6 cycles is okay.
You just now spoke about the role of the sperm, the embryo, and also one more important aspect is the uterus. And of course, you know, we all understand with the change in lifestyles, that is also very much impacted. How can girls work on that aspect of their body to make their bodies healthier?
So, you know, as far as health is concerned, whether it is your eye health or your heart health or your bone health or uterine health, everything revolves around your nutrition and your exercise. If you can pump in a lot of blood into, and we are doing a study on this, I've introduced acupuncture also in my, and Ayurvedic massages also in my, to see if I can increase the blood supply to the uterus, if I can work on those REN points on the uterus and give more blood. The moment you have more blood and more nutrition flowing into any organ, whether it is ovaries, eggs or uterus.
Right.
That's the way. So I feel, you know, all these girls, I would like to have a more disciplined life. We should do away with pizzas and I'm happy Modi ji has introduced millets into our diet, which are so much more healthier. You know, we've all become, you won't believe the kind of allergies, the wheat allergies which are there now. So it's time now we looked at all this again. अपना डाइट और अपना एक्सरसाइज एंड अपना जंक फूड से हट के रातों को सोने का टाइम है, यू नो, रादर देन कि रात भर जगेंगे सुबह सोएंगे, यू नो, ऑल दिस हैज़ टू गो ऑन अ वी हैव टू गो बैक टू आवर रूट समवेयर.
Right. Probably that is the only way we will be able to live a better life.
Absolutely.
So this was Dr. Rita with us, and now we'll go on to Saarthak Bakshi, who's a son and who's handling the business aspect of Risa IVF. Let's speak to him and he'll explain to us the entire working of the clinics. So we have with us Saarthak Bakshi, who's the son of Dr. Rita Bakshi, and he's not a doctor, but he's helming Risa IVF. So hi, welcome to the show.
Thank you.
First tell us about your education and how you ended up in healthcare.
So I started, after my schooling, I went for computer engineering. I did that. Then I pursued my MBA. And after that, we started this business roughly around 2012-13 when I co-founded this chain of fertility centers with my mother. So before that, I was always inclined towards business. So luckily enough, I was blessed to have parents who could support me to start businesses. After engineering,
usually it's like a doctor wants the child to become a doctor. Wasn't that the case in your house?
No, so they were very free with that concept that, you know, choose whatever you like. And though both my parents are doctors, I could obviously see becoming going into healthcare or choosing medical as a profession. But I don't believe that in these days that the amount of work that healthcare professionals or doctors put in and the rewards that they get vis-a-vis with the work that they're putting is not there that much. Even if you pursue any other thing, with the rewards are way higher, and the amount of time spent in reaching to your destiny is lesser. So I could never feel that. And obviously, I mean, candidly speaking, if we had I would have had more motivation if we had a hospital set up where I would just come in and take over, or there was a clinical establishment. Just that, that most doctors, their children become doctors themselves. Is they have a setup already to come and pursue. At that point of time, when I had to decide my profession or choose a career, both my parents were working in separate hospitals and jobs. So I mean, it did not make really any sense to come become a healthcare professional.
So when you joined your parents' business, what was the idea behind it?
So my father, he's an MD medicine and he's still practicing as if his own. My mother, they started a hospital, but as great doctors are, they're extremely bad managers and administrators. So by the time and that point of time, I started my own business. So in 2010-11, I was as an engineer. I was making and I was running an IT industry. Making games for iPhones and iOS at that point of time. So when I burnt my fingers there, and I thought, I mean, does not make any sense. Let's go back to a job, if the business is not making sense. And then that's when my mother said, IVF, if you want to look at IVF, look at something if you can do together. And that's where we started our first IVF center together in 2012.
So how is the business placed now? How many centers do we have?
So right now we currently have between 12 to 14 centers, and we're always growing. We're trying to open one center every 3 months, trying to grow organically. It's easy to grow inorganically and open up, but then you could definitely see with the startup failures and with extra amount of funding, there's always a pressure. So we never wanted to do that. Currently, we are placed into many cities: Bareilly, Pilibhit, Delhi, Noida, Jalandhar, Jaipur, Lucknow, Kathmandu, Biratnagar, and vis into other places. So our motto has always been that IVF as a service is a little saturated in the densely populated cities, as in metro cities. But in tier 3, tier 4, there's a lot of scope. And there's a misconception that infertility is a rich man's disease, that
Right.
people who smoke or drink or party or don't have a lot of stress, so infertility is meant for them. But I mean, the disease does not choose a particular genre, so it can happen to anyone. It's a lifestyle disease, and by lifestyle, it does not only mean a bad choice of a smoke or alcohol or any other thing. It can be the environmental factors. It can be this. I mean, stress is equivalent. I mean, a poor man has its own stress. A rich man has his own stress. So
Right.
stress is equivalent to based on there. So other factors like the environment, the pollution, the kind of food, inorganic, organic food that you're eating. There's so many things.
Right.
So there's a lot of infertility in tier 2, tier 3, tier 4 cities. And we get this question a lot, does India require more babies? We are the world most populous nation. We have overtaken China last year, but do we still need more babies? So our motto has always been to give babies to those who have zero or none. We are not giving babies to the fourth or fifth, someone who already has 2 or 3 or 4 babies and they're not coming to us for the fifth one. It's those people who are married for a long time, more than 5 years, 6 years, and haven't still been able to conceive. So our motto has always been to give on that, and we follow this philosophy of OCPC, one child per couple, that you actually have to, procreate and give one child to any couple that has been married.
So if we put a number to how many successful IVFs have we had at
Oh.
Risa?
Also, we now, by the time since you started, we have done upwards of 10,000 IVF cycles, and our success rate has been between 65 to 75%, all of that. So quite a lot of number of babies we have given, till now. And we have had patients from all across the world, many African countries. There would be countries that you would not have even ever heard of: Comoros, Sierra Leone, Madagascar, a lot of small islands across the Australian Pacific belt, Haiti, Samoa, Fiji. We're getting patients from there. Apart from the bigger countries, we obviously are getting patients such as the Middle East and all of that. So we
And
not
why are
only
they coming to India specifically?
a couple of reasons for that. India being number one is that our medical expertise is very renowned. I mean, all across the world, not only for IVF, for any other specialty, Indian doctors are known to be very well and well respected. Secondly, is the cost factor. We are the most affordable, probably if I have to use the word cheapest, IVF service across the world. The cost of an IVF over here is the least anywhere across the world. So with both these factors, that with a highly reputed medical expertise and with the amount that is in comparison to it, that's where we would be the first choice for anywhere across the world.
Right. And you've got franchisee or you run
They're
all the
all
others?
self-owned. I have been asked this question that why don't you franchise? I don't believe, because this is even no. So you require system and processes in all
Right.
business, but ours is such a scientific process. So you're creating life in a petri dish. You cannot systemize that. Even if you try, it's very difficult, because when you say that our success rate is 60% or 70%, there's that offset charge of 30%. And between that 30 to 50, the failure, between from 30%, it can increase till 80% or even be complete failure. How do you mitigate that? Because the chances of success are dependent on 200 factors. It's not dependent on one. It could be the medicine, it could be the doctor, it could be the laboratory conditions, it could be anything, the technical experts that are doing there, it could be the patient himself who is not following up with the proper dose of medicine, not proper taking care of themselves. So the chances of failure are so high, you can't pinpoint that. It's the same way as making a pizza or a burger, that 99% of the time it's going to be very similar. There will be an offset of that, but in our case, the chances of failure are so high in every different cycle that we can't say that, okay, this is franchised, you can do it yourself. Because when the cycle fails, the blame comes to the doctor or the brand itself.
Right.
And you can't franchise that thing out. So that's where we have always had everything in-house, have maintained the philosophy of growing organically, bootstrap, opened up IVF centers based on our cash flows, and that's how we expanded.
Which is fantastic. And so how are you doing turnover wise?
So right now we are roughly clocking around 20 to between 22 CR per annum. We've been growing 20% or 15 to 20% annually. We've been doing having a growth of all of that across our business, and we are happy with that growth.
Which is a fantastic beginning, I would say, because India has a lot of scope for IVF.
True.
And a lot of more things can be done.
Yeah.
So, Saarthak, can you show us the facility around?
Sure.
I would
please.
be very interested in seeing how the process goes on.
Sure.